Hello everyone and welcome to the Say Yes to Life series. Say Yes to Life is an initiative introduced with the aim to offer hope to every person suffering from mental illness through awareness building and reducing the stigma of talking about mental health. This series will feature India's foremost psychiatrists sharing their perspective on the forces that shape the mental health narrative. And I'm so very delighted to welcome our featured speaker for the third session of the series, Dr. G. Prasad Rao, a senior psychiatrist from Hyderabad. Dr. Rao needs no introduction. With 40 years of experience in psychiatry, Dr. Rao practices at the Tapadia Diagnostic Center, Bhagyanagar Diagnostic Center, and of course, Asha Hospital, Hyderabad. Dr. Rao, thank you so much for being with us on the Say Yes to Life series and welcome, sir.
Thank you very much. First of all, I have to say yes to the mental health. Now I have to say yes to Shaan as well. And so great pleasure to be with you and with the large audience who are going to learn from our interaction a little bit or even a large bit of mental health issues.
Yes, Doctor, while I may ask you a few questions that I am curious about, I learn from you, and hopefully a lot of us who are in the situation of some kind of a mental health situation, not personally or maybe with family, among friends, will surely learn so much from whatever you tell us with your vast experience and knowledge on this field. So, Doc, my first question would be: there's always this confusion between sadness and a state of depression or clinical depression. So, what is the difference really between sadness and clinical depression?
That's a wonderful question. In fact, like happiness, tension, anxiety, jealousy and sadness, these are all normal emotions. Normal means you and me would have gone through this 100 and 1,000 times.
Of course.
But the difference here is a normal sadness obviously lasts for a few moments. It is depending on the situation. And the situation is, for example, your lover didn't call you on time or your wife didn't respond the way you wanted. You are upset. That upset leads to anger and sadness simultaneously, and then you move on. How do you move on? You get over it. Now the difference in terms of clinical depression, obviously when we are talking clinical, which means one, it is much beyond the expected reaction for that situation. Obviously you might ask what is normal. Now for a grief, the normal period, grief means you lost a position, you did not get a job on time, or you lost a lot of money, you lost a loved person, or even you lost a loved pet. The reaction is usually a sadness lasting up to 6 to 8 weeks. So for that is called a grief. So that can still be a normal as long as you are going through and you overcome it. But clinical depression technically is much beyond certain period. It also differs in terms of not only quantity but quality.
Okay.
The quality is the intensity. Yes, you might ask me, intensity does differ from situation to situation.
Right, and
how
person
do you,
to person also.
Person to person also.
Some person can handle grief a little better. But when does one know that no, this is more than just something that's triggered off that situation, be it a loss or
absolutely whatever. The individualistic variance is again within a certain norm pattern.
Right.
So, but we know, or the family members know, that this individual is definitely reacting much more than what is expected.
Correct.
One. So qualitatively, how is it different? To this symptom of depression, what we just thought about sadness lasting longer period, we also add a lot of other symptoms to call it a clinical depression.
Okay.
We means we observe in the individuals, they don't sleep properly. The first signal, first red signal, red flag is you're not sleeping as you are supposed to sleep. For example,
so you're restless and you're not, you're probably sleeping in the wrong hours.
Wrong hours. The basic thing is if your Shaan is sleeping only between 11 to 4 o'clock, he sleeps much less, he doesn't get sleep on time, he wakes up too many times in the night. Most important, he doesn't get up with a freshness which normally each individual gets up. So this is one quality and quantity.
Right.
Apart from this, slowly but surely you get other biological symptoms. For example, you lose interest in taste. You don't want to eat food. You don't enjoy food. Even the best food prepared by your spouse or the family, you don't like it. Then comes the appetite on sex, slowly. So these symptoms keep adding, but surely, and it affects the day-to-day functioning. You're not able to concentrate. You keep worrying on small things. You keep worrying on probably a thing, but too many at times, too much, qualitatively different. So certain clinical symptoms, as you call it,
Right.
is persisting for a longer period, affecting day-to-day functioning. Core symptoms are the distinct sadness. And I might add one more secret to you. A clinical depression, morning times are usually the worst.
When you just wake up.
Wake up, you don't feel fresh. And not so surprisingly, in a clinical depression, by evening you might feel little better than compared to the morning. So this is called diurnal variation. Morning times worse and evening better. Converted necessarily into a negative mode, trying to justify your own negative state for some times at least. You say, today I'm tired.
Right.
Today I'm upset. Today is not my day.
Right.
But 1 or 2 or 3 days is okay. You asked right in the beginning, what is normal depression? That is normal depression.
Right.
We feel sad for a few moments. Moments means a few hours, maybe a few minutes.
But
then
now I want to ask you what should I say? What if someone feels that if I can do this, I have to go to office, I have generally a busy life that I'm not being able to cope with or handle with. And how does one know this is surely clinical depression and not an excuse to just escape from, certain stresses that one has to cope with in general living? Sometimes it can be an easy way out for someone to just say, today I can't come to work, so this and that, and let's just, do people ever do that? Have you had patients who have not...
Like our 5 fingers, each one of us are different in our expressions, no doubt. But you asked a very beautiful question. How about a person who wants to escape?
Right. Yeah.
No, this is not you. The differentiation is, this is not you. You have never done this. In these days of depression, in these days of melancholia, you start thinking, can I postpone not going to office today? Let me, for example, you might say, I'll postpone my shoot for tomorrow. Today my mood is not good.
But I never did that in so many years.
So many years.
So you know that this is not the real way the person functions, but obviously something has changed.
So the best answer probably for your question would be is, one, you also know this is not your normal.
Right.
But more important, along with you, people surrounding you suddenly realize that you are not your usual self. For example, you are such a perfectionist that you come on time. It's very easy for your wife to recognize that today you are not doing your normal self, normally also. But if it happens too regularly, repetitively over the next few days, they will recognize. But of course, they would try to justify it. They say, no, come out. So what is the common way you do it? Come on, boost yourself, come out. So each one, as you correctly said, would try to come out of this gloomy blue periods, we call it blues, to come out.
With a little help from your friends, or
usually family members, friends.
Take a break, get a nice rejuvenating
Maybe
short vacation, and you're back, or you have
Mauritius or
yeah, actually,
right.
Doc, I had a very as I was asking you these questions, I was even more in a way feeling a little sort of upset with myself that about 3 years ago my wife was diagnosed with this sort of a situation, clinical depression. But until that happened, for a good 3 or 4 months, she kept it from me, and even I couldn't see what was happening. I found her to be a little being a little too emotional from time to time, crying too easily on certain things. But she is an emotional person, so until then also I didn't realize she would be maybe in the restroom so much longer than her normal self. But I was also probably too caught up or preoccupied with what I was doing, and I just let it pass until
It's good you brought this issue.
yeah.
It takes sometimes few weeks, even few months to recognize that you're a loud person whom you have seen for.
Yeah.
First of all, there is always a denial, saying no, she's just coping.
Yeah,
she's
it's
just coming
today,
out of it.
yeah.
Just
And
today.
then you have certain days where you think she's okay,
So that
you-
is the
you
first
think-
phase. We call it
Yeah.
denial. The next reason is you also start looking what's happening. You might at that point of time find out some cause. For example, her health was not good. She has irregular periods, or you would say that her work is now pressured, or there are some psychosocial issues, the usual psychosocial issues which every one of us have.
True.
Then you go a little further. It takes few days to few months, but the point is the productivity is coming down in that individual.
True.
They are not the usual self. You are not enjoying. You are not enjoying it. And you brought out another important point as well.
Right.
More commonly than men, in women, depression comes out like weeping. Men's
Right.
usually hold themselves little longer. So if a man is weeping, and that too little more frequently, you are sure he is 100% depressed. But for a woman, we might take over. We don't know it's her trait or nature.
Right.
So weeping is one part. The other important part is usually they start getting guilt also. For example, a housewife is not able to work,
Right.
and she knows she's not attending on the children, she's not cooking properly for the children, not keeping ready for the husband. She feels sorry, and there's
Yes,
an
this was something that kept recurring.
excessive guilt.
Because she had taken up she had started an initiative of her own, a startup, and every other day was, I'm not there for my children. Why am I doing this? So I was telling her, children are now old enough, and and you're
move
very
on.
good at what you're doing, so do it. But something like this for a man, you probably don't expect a man to feel guilty because he's conventionally supposed to be the provider, and so if the man is
Authority.
saying कि no, I have to sit at home and be with my children, the wife might tell him कि अरे वाह ये क्या चल रहा है आजकल, जाओ काम पे जाओ. But if the wife is saying that, then obviously you give in to that, and then you tell her that no, come on, it's great, what you're doing will be fine.
Exactly.
But yeah, that was one thing, that guilt would then lead to
Then they start
overreaction,
also,
and yeah.
and in India, and in Indian population,
Right.
depression need not necessarily come with all thoughts and emotions.
Right.
It comes with body complaints.
I'm sorry?
Body complaints, like you start
Okay.
having regular headaches,
Okay.
chronic backaches,
Okay.
multiple body aches, weakness. Where it is beautifully described as body symptoms,
Okay.
aches and pains of everybody. One of the significant things is the reduced sexual drive and not able to enjoy anything, as we already said. All clubbed, but it takes 3 to 4 months before
You
a
can
close
actually
family member
understand
sees,
something is going
something
wrong.
is happening.
But we should keep our, we should be aware of this. Yeah,
Eyes and ears
Eyes and
open.
ears. And more importantly, have compassion when you realize this has happened. Because yes, my first reaction was that, oh, come on now,
Fight it out.
Yeah, fight it out, and you're stronger than this, and you just sometimes just
Giving
use
a
words
boasting,
that
I would say.
make them
You keep
feel more
boasting,
helpless.
yeah.
They feel that they're
Absolutely.
making it
I
so
think you-
easy. Why can't I do it?
No, you said very correct word.
Right.
See, by your own so-called boosting at that time, if a patient or an individual is in depression, clinical depression,
Right.
you are actually making them feel much more worse.
Yeah.
Because you are actually pointing out what their deficits, they might get magnified in their own thought process, and they think, no, I couldn't even give a glass of water
Right,
for a
right,
guest. I didn't attend on my mother-in-law. The
True.
common things which they normally do, not able to do, are magnified. So you're right. I think the problem also gets magnified because the thought process is a continuous process, and it's a
So what is
negative
the first initiative or first step or the first thing that one should do? I understand, of course, at some point you have to, take professional help on this matter, because it's like you said, it's neurons, and it's a chemical thing. So
one. What is the first thing which we do is
like a first aid for mental health situation.
Yeah. The first phase obviously is to listen.
Okay.
Listen, because they say, and a lot of songs also tell us,
Right.
listen to a person who is in distress. By just merely, you see, your friend would have lost about 10 lakhs. So you just sit, listen to his all the stories. By the time he finishes talking for 2-3 hours, he is less burdened at least.
True.
You are absolutely right. Be empathic. Try to be. Instead of saying that you have done a wrong, instead of commenting, criticizing and explaining, just listen. But empathic
I've
listening.
noticed in most of the movies when they show, the psychiatrist and that's the one thing I've noticed. That they hardly speak. They just keep asking questions and the person himself starts talking or she goes on,
Start reacting.
And I've noticed that they have a certain composure. They say, oh, why did you think you said that? Why did you
Exactly.
think? Yeah, so
I think you're already acting like a psychiatrist.
yeah, they have that relaxed
Demeanor, yeah.
So how do you get? I mean, in Hyderabad, do you get a lot of people coming to you with
Depression.
depression, among other, of course.
It's one of the most common disorder.
Okay.
If you take the general population means everyone in the society.
Right.
At this point of time, at least 5% need
Oh my God,
some
that is
kind
a
of
very,
help.
very, very
Out of
big
100, 5
percentage.
people. That's a very big percentage. And you don't be surprised, depression right now in 2020 is the second most common disorders among all the hundreds of disorders causing disability. It is the second most, and it is predicted.
After heart
Heart has now gone much lower
Okay.
now. In fact, the top one is in accidents.
So this is an accident, of course, is not in our hand at all or control at all.
Sometimes, yes.
So yeah, I mean, of course, yeah.
Yeah.
You've got to very well keep your seat belts, drive safe, all that. Yeah.
But the major depressive disorder is the second most common disorder which causes, or the second most disorder which causes maximum disability today.
My God.
Today, 2020.
So it's a
See,
very
I think you also
shocking
brought out one
statistic.
more issue, that it takes time for the people to recognize. So what we are doing from this program is to tell the people, wait for 6 weeks, maximum 8 weeks, at least go and, you also hinted that you should talk to somebody,
yes.
talk
I mean,
to your
that's
mentor.
the first thing we did. We
talk to a relative.
We I think it's easier to speak to a professional, speak to a counselor, speak to a, because then they can give you a very unbiased or they
At
know
the same
exactly
time
what
empathy.
it is.
At the same time empathy.
Empathy, yeah. Sometimes it's difficult for even a mother to accept something like that,
See, they will be in a denial for a much longer period.
Yeah.
My son can never become depressed.
True.
There's no stigma
And
at all.
you hold it against like, we are in the same boat, we are in the same situation. Look at me, I'm fine. Why are you like that?
Exactly.
And,
I think this word, what you just now
Yeah,
told,
yeah.
is very commonly used by family
True,
members.
true.
And you understand.
That makes it worse for them.
It makes them worse. It makes them others feel that you are actually causing much more harm to the family than yourself.
Right.
So three things we should give through the message through it.
Right.
One, try to talk to your family member. Listen to the family member, talk to the family member. Don't give any strong advices. First say,
Right.
just allow them to talk and ventilate. We call it ventilate, of
True.
course. You know what ventilate means.
And as you're saying it, I'm thinking of all the things that I did wrong.
See, at
But-
least, no, but through this program,
I mean,
hundreds
yeah,
and millions
hopefully
people
others
would
won't.
be
Yeah,
would
yeah.
not do the same mistakes.
True.
The second thing is, yes, if your sleep disturbed for more than 8 weeks, reach out to a professional, because even at that stage, medicines might not be required.
Right.
You just need to talk. But there is a critical point when the doctors, psychiatrists recognizes, no, they need, of course, the best therapy starts from the simple psychoeducation, what we are doing right now.
Right.
Explaining to them, this is treatable, nothing to do with stigma. I keep telling, Deepika Padukone also had depression.
True.
She's so popular, she's so rich. I mean, from our point of view, she reached what?
And she stepped out, she spoke about it, she, accepted it.
Accepted it.
And then I think
Propagated it.
that helped her,
Yeah.
come out of it also.
If your medical tests are normal, but you're still suffering, that's the time you at least recognize that time to visit a psychiatrist and get a check done. Maybe you'd get a better answer there.
Yes,
All the
yes.
normal reports. So this is one more message I think we should give.
True.
when we are talking about normal depressions and depressions.
Wow, so in that sense, when you say 5 out of 100, now I'm beginning to think maybe the number's even more.
Yeah,
But
yeah.
thank you so much, Doctor. That was a wonderfully informative and in-depth discussion on this topic. Thank you so much for being with us. And I know you work, extensively and intensively in Asha Hospital, and Asha really is the word that we want to leave this discussion with.
That's a positive hope. Yeah.
बिल्कुल बिल्कुल जहाँ
Thank
जब जब तक उम्मीद पर दुनिया का
हम होंगे कामयाब.
हम होंगे कामयाब. In fact, many years ago, I'd made a song on getting over a sad phase. So अगर आप कहें तो
एक बार
उस गाने की
सुना
कुछ
दीजिए.
लाइंस आपको सुना दूं. Actually, तन्हा दिल तन्हा सफर जो ये नया गाना मैंने बनाया है ऑन मेंटल हेल्थ, इसी दौरान मैंने ये गाना बनाया था, भूल जा. It was इन आंसुओं से किसको क्या हुआ हासिल, माना कहना है आसा, निभाना है मुश्किल, फिर भी ऐ यार मेरे सुन ले मेरी इल्तिजा, भूल जा जो हुआ उसे भूल जा, है कसम तुझे मुस्कुरा, खुद को यूं न दे तू सजा, उन यादों को तू भूल जा.
Oh, wonderful.
So yeah, this
I
is
think you said two things.
जी.
Bhul ja and muskura.
मुस्कुरा.
I think both are required for our suffering depressed patients. I think your song is so beautiful.
No, it was done unwittingly, but today I think it kind of made a
It came
connect.
spontaneous.
Yeah. So thank you so much, doctor. Thank you so much, guys. And that was Dr. Rao with us from Hyderabad, and we had a wonderful in-depth conversation about how we can make a difference between what is sadness, what is clinical depression, and of course how can we can go about making a change, and it is 100% we can recover. So let the hope be over fear. Thank you, doctor. Thank you.